a little bit about me. I am a sex therapist, but I've also got a nursing background. I used to be a casualty sister, had a baby, didn't want to work full-time in casualty, and ended up doing urology research 2 days a week, part-time. Thought, fabulous, this is good. And the research was a tablet that was a blue colour. And it hadn't got a name, it just had a compound number. And I was giving out these tablets to the men, and they were coming back to the clinic with them, talking to me about their sex lives. And I was bright red. I didn't know how to speak back. I didn't know what words to use. And then over time, I thought, how ridiculous. We should be discussing sexual function with patients. The tablet turned out to be Viagra, and that was sort of 18 years ago, really, in the trial state. And it became clear that there's a man attached to the penis, and there may be a partner attached to the man or not. And so actually, over the years, I've become very much less inhibited talking about sex, as you will find out, and think, oh, you know, we should be discussing sexual function with patients and partners where appropriate. It's great that some ladies have come this evening. Maybe I should have said, you know, the more ladies or partners of the same-sex couples that come along, the better, because sex is adult play. So let me move on, and the erection connection is hopefully at the end of... Can I speak for about 20 minutes, half an hour? Is that okay? Thank you. That you'll understand where I'm coming from and why it's important that you do get the help that you need. We've already heard Tan mention about prostate cancer and the importance of managing sexual function. And here we see with NICE guidelines that came out in February 2008, the importance of that. Because I think you need to feel comfortable asking your clinicians that you see at the hospital or in your surgery, that you can talk to them about your sex life regarding prostate cancer, and it says very clearly in NICE guidelines about that. Because it still can be a bit of a taboo, can't it? You feel a bit bad, you know, can I spend the time in the NHS talking about my sex life? Yes, you should be able to do that. And the World Health Organization have a declaration on sexual health. And I'll just give you a few seconds to scan through that. Certainly freedom from fear, shame and guilt. They're some of the things that the men that come to the clinic say to me. Actually, I feel, you know, maybe I shouldn't be here. I'm 70 and maybe I'm too old. And my comment to that is, 70 is no age nowadays. I can't do anything about it if you're 6 foot under, but of course you should be here getting help. But sometimes it's that olive branch to make them feel, you feel comfortable to talk about it. You may feel inhibited, so you say something to break the ice. Freedom from organic disorders, diseases and deficiencies that interfere with sexual and reproductive function. That's what prostate cancer does. Let alone the treatment, just given the diagnosis knocks you for 6. And sex becomes bottom of the pile often. So why should we talk about sex? Well, our psychological well-being is as important as our physical well-being, and it gives that holistic approach. It's good for self-esteem. For men who are on their own or in a relationship, the fact you can get an erection feels good. The fact you can hold it. You can go to the loo and pee with a decent-sized penis at a urinal, not having to find a cubicle because the atrophy's occurred that Tan's mentioned over time. It's got smaller and I can't hold it there anymore. Good sex usually takes place within the context of a good relationship. Or in a good relationship, hopefully there is good sex. That doesn't have to be intercourse. That may be the little cuddle on the sofa watching Downton Abbey or the footy. Because actually it's intimacy, it's the glue, isn't it, of your relationship. It doesn't have to be, you know, a penis in a vagina or any other orifice. It could be just the little things that keep your relationship going strong. I've referenced some books at the end, and one of them is Bernie Zilbergel's The New Male Sexuality, and it's a great book about men and sex. We're very fortunate as women. You know, we tend to talk to other women. You don't talk to other men. You're in a unique position this evening, aren't you? That you've got other colleagues and friends around you that have got the same common interest. But actually, with erectile dysfunction in particular, we know at least 1 in 10 men have the problem, but people tend to keep it within them. They're too embarrassed and ashamed and want to talk to people about it. So if you get the book Zilbergel's, it's about £10, you can get it off Amazon. It's a really good book about when sex works fine and when things go wrong. And getting an erection, well, we don't bat an eyelid when it all works well. The biggest thing is the brain. That's the biggest sex organ. You need to have the desire for sex, to become aroused, hopefully get an erection and ejaculate and have an orgasm. And when all these things happen, you tick the box off. That great, fine, everything's okay. But as we mentioned, prostate disease, diabetes has been alluded to. They can affect that normal erection, the arousal response. Alcohol, drugs and substance use, smoking and obesity, again, they all have relevant factors involved with erectile dysfunction. We may be talking about prostate disease at the moment, but we don't come unique just with your prostatic disease. You know, we have got to think about people as individuals. And if you think of the penile vessels, they're tiny. The heart vessels are much larger. We've talked a lot, haven't we, over the years about smoking and erectile dysfunction, and it's not good for you. We now know that men with erectile dysfunction who present with it can have problems going on, an organic cause for it, prostate disease, may have heart problems. But the first sign of it, because your vessels to your penis are tiny, is them start to occlude and you're getting erection problems. So, you know, the old jokes about having ED and not getting it up anymore, hopefully they're a thing of the past. You know, there's real reason why a lot of men have erection problems. Well, I've mentioned self-esteem. Impact, even if you're not in a relationship. Certainly in Buckinghamshire, where I live, I used to see a lot of men saying about going off to tea dances. They'd been widowed or divorced, and they were meeting these ladies but couldn't get an erection. So it was really important for them to be able to get an erection, as I say, even if you're on your own, because how are you going to form a relationship if you can't kiss and cuddle, because you feel embarrassed, because you can't get an erection? So it's important. Relationship changes. Couples have been said that only 1 in 10 people keep any relationship going when there's erectile dysfunction, because it is that little squeeze, little caress of the arm that may have led on to something else that stops. So intimacy changes. So I certainly would encourage all patients to bring partners along to a consultation. So do feel that if your partner says, oh, should I come with you or not? Yes, sex is a together thing. And actually, there's 2 heads to remember what's being said. And your partner probably went to a lot of consultations with you with a diagnosis or your symptoms. So do involve them in discussing sexual function. Testosterone deficiency. We know that obviously managing prostate cancer, it may be involving dropping down the testosterone level, and you've been given hormones, but it can give this lack of desire. So the sexual functioning in the brain that I spoke about diminishes. But you still need to keep erectile function going. Having that lack of strength and vigour, and your body changing and getting a bit of fat around the abdomen and losing your muscle tone changes how you look as a man, and that can impact on how you feel. So these changes, sometimes they can be for the better. They pull a couple together and they'll go through a process together. Sometimes it sort of makes people go their separate ways because they feel embarrassed and awkward to discuss things. I'll often say, you know, this change has occurred, but we're dealing with a situation. That's why I tend to use therapist in sexual well-being, not the ED nurse specialist that I was known about years ago, because dysfunction's all very negative. You are in a situation where maybe you've been given treatment, but now we need to bring about some positive change. So using your senses of smell, sound and sight, using them when you're being sexually intimate. You may have done it years ago, but you've forgotten that you did that. You got into a bit of a habit of having sex in the same way. So using your senses is important to rekindle intimacy. And think about body image. I've had a few men say, since I've had my prostate removed, I feel like a woman must feel when they've had their breast removed for breast cancer. It's quite a powerful comment, isn't it, when we don't see the prostate. It's within, but men can feel like that. Communication. Again, it can be difficult to communicate with somebody if you don't know what help there is or how you're going to feel. How can I tell my partner that I'm feeling like this? A lot of female partners often say, I know it's the surgery, for example. I know it's been since he put on his hormone treatment, but him not getting that erection anymore and I can't see it isn't a trigger for me to know he fancies me anymore. So they can feel quite isolated. and anger and bereavement. As I mentioned back in my old accident and emergency days, anger and bereavement. Why has he died? Why has he dropped down dead of his heart attack? That's how some people feel when sexual function changes. Why has it happened to me? I was just retiring. I was looking forward to my retirement. Or, you know, I'm only 50 and it's been diagnosed. Shouldn't this be happening to an older man? There's lots of things go around in people's heads. Now, yes, I've alluded about Viagra, which has been out since '98, and we've got 2 other tablets, Levitra and Cialis. But here we see that actually, sometimes it's all thought, well, if you take that tablet, you'll get your erection just like that. And it's that magical thinking. But actually, you developing and maintaining an erection is important. It's part of your emotion and your intimate response with that sexual response that I spoke about having the desire and the arousal. So don't be too disheartened. If you do try a tablet and it doesn't work, it may not work for many reasons. Now we can see here, now I see lots of men in my clinics who have a Mrs. Schwartz at home. I think this is quite good actually, that the penis is a barometer of what else is going on. So if you haven't had a problem with it from your prostate cancer, you may have met some partners along the way that have made you feel like that. And I actually think we're getting more men who feel like that because women are they know what they want. They're becoming rather more sort of verbal in what they want sexually. So I'm seeing a lot of younger men actually with erectile dysfunction who certainly are in this position.